Uterine fibroids are non-cancerous growths that develop in the muscular tissue of the uterus, known as myometrium. They are also called leiomyomas or myomas. Uterine fibroids are quite common and are found in up to 40% of women by the age of 50. While some women with fibroids may experience no symptoms, others may experience a range of symptoms, including heavy menstrual bleeding, pelvic pain, and infertility. In this video, we will explore the symptoms, diagnosis, effects on health and fertility, conservative management, medical management, and surgical management of uterine fibroids. The symptoms of uterine fibroids can vary depending on the size and location of the fibroids. Some women may have no symptoms at all, while others may experience heavy menstrual bleeding, prolonged periods, pelvic pain, frequent urination, constipation, backache, and pain during sexual intercourse. A pelvic examination is the first step in diagnosing uterine fibroids. This exam allows the doctor to feel the uterus and detect any abnormalities. Other diagnostic tests that may be ordered include an ultrasound, MRI, or hysteroscopy. In some cases, a biopsy may be performed to rule out cancer. While uterine fibroids are mostly non-cancerous, they can have a significant impact on a woman's health and fertility. Large fibroids can cause heavy bleeding and pelvic pain, which can lead to anemia and other complications. Fibroids can also interfere with fertility by obstructing the fallopian tubes, blocking the sperm from reaching the egg, or preventing implantation of the fertilized egg. Conservative management involves treating the symptoms of uterine fibroids without surgery. Some conservative treatments include non-steroidal anti-inflammatory drugs, NSAIDs, for pain relief, iron supplements for anemia, and hormonal medications to regulate menstrual bleeding. Lifestyle changes, such as regular exercise and a healthy diet, can also help manage symptoms. Medical management involves the use of medications to shrink or slow the growth of uterine fibroids. Hormonal medications, such as birth control pills or a progestin-releasing intrauterine device, IUS, can help regulate menstrual bleeding. Gonadotropin-releasing hormone, GnRH, agonists can also be used to shrink fibroids, but these medications can cause menopausal symptoms and cannot be used for long-term treatment. Surgical management involves the removal of uterine fibroids or the uterus itself. Myomectomy is a surgical procedure that removes only the fibroids and preserves the uterus, making it an option for women who want to preserve their fertility. Hysterectomy is a surgical procedure that removes the entire uterus and is an option for women who no longer want to have children or have severe symptoms that cannot be managed with other treatments. In some cases, a newer procedure called uterine artery embolization, UAE, may be recommended, which blocks the blood supply to the fibroids, causing them to shrink. In conclusion, uterine fibroids are a common condition that can have a significant impact on a woman's health and fertility. While some women may have no symptoms, others may experience heavy menstrual bleeding, pelvic pain, and infertility. Conservative management, medical management, and surgical management are all options for treating uterine fibroids, and the choice of treatment will depend on the severity of symptoms, desire for future fertility, and overall health. If you suspect that you may have uterine fibroids, it is important to speak with your healthcare provider to determine the best course of action.